Today, Megan and I will be presenting our group's PowerPoint on Unit-Based Leadership Council. This was created by Marie, Amanda, Brian, Allie, Megan, Carla, and Kay.
Objectives. Define a unit-based leadership council. Explain the purpose and goals of a unit-based leadership council. Discuss who is involved in the unit-based leadership council and their responsibilities, and how to create and market a unit-based leadership council. What are UBLCs? They're a professional practice model that promotes nursing empowerment and shared decision-making by making staff nurses accountable for the decisions that impact policies, procedures, and processes at the point of care. A UBLC is formed by professionals working together in a nursing unit who want to meet and address pertinent issues within their work environment. For each patient care unit, a unit-based leadership council should be organized and responsible for making nursing practice decisions for that unit. The UBC allows frontline clinical nurses and other staff to share power, control, and responsibility in their work areas across the hospital system. Decentralized decision-making is a core component of organizations with magnet designation. A shared governance is the cornerstone to a UBLC. It illustrates how a UBLC operates. It is an effective technique for empowering nurses and improving patient outcomes. Implementation in an institution can be time-consuming, overwhelming, and involves hard work. Once accomplished, however, the positive outcomes of shared governance typically outweigh the difficulty of implementation. Here's a video that provides a little bit more information on shared governance.
Governance is an important issue in nursing, especially when we talk about different levels of nursing and different activities that we participate in nursing. It involves looking specifically at how we care for patients, what we do about making decisions about taking care of the patients, as well as what information we gather to take best care of the patients when it comes to patient outcomes.
Shared governance gives the nurse a voice and an opinion, and it gives them the possibility for them to share the knowledge that they have, because sometimes we know of things that are going on, but they don't know the knowledge that the nurse at the bedside does contain. And they're able to share that with us to improve a process.
So we've got nurses who've been on there for 30-something years, and it allows them and the newer nurses to see like what they could implement on the floor. And it really gives the nurses a kind of ownership of the floor to help improve it and improve patient care.
It's about supporting each other, because I feel that when we're empowered and allowed to do our own more management from within, from ground level, you get a lot more done. You are doing it yourself. You are passionate about it.
It brings a voice to the nurses, especially down in the emergency department. It's really important for us to have a voice.
So I think the shared governance is kind of the collaboration between all the different teams and valuing each member, which I think is a really unique part of UChicago. We do a really good job of making sure that every member is heard.
I think that shared governance, it helps promote nurse autonomy, and it holds nurses to a high standard, and it's a great way to get everyone involved on what's going on in the hospital.
It ensures that the decisions that we're making to be patient-centered and patient-focused are being done with the provider, with the people that are impacting or touching the patient.
Shared governance is empowering nurses like us because it provides all of the ideas. And the good thing about it is not only about provide safety for the patients, but it provides ideas from all other nurses, from the management and support.
I see that more now as a manager. It's even more important to be involved in your profession. We build our structure and we support ourselves as well as nurses, and we're practicing within our scope. So that's all part of that big process. And so being involved and knowing what's happening with your team is really important.
We're constantly doing projects on our unit and making changes, and we've really seen, good changes come out of the projects that we come up with ourselves, just from being in shared governance.
And that means happier patients, better outcomes, improved safety, and that's what it's about.
Based Leadership Council goals. They include promoting evidence-based practice, increased job satisfaction. Research supports the UBLC's contributions to increase staff engagement and frontline empowerment, creating a more satisfying environment for staff and patients. Other goals are to foster professional growth, strengthening interprofessional relationships, improving nurse retention. If nurses feel as if they are supported by their managers and unified with their unit staff, they are more likely to remain there. Since structural and interpersonal attributes can influence the patient's experience, a major goal of the UBLC is to provide a framework for patient-centered care. This would further enhance the patient's experience by improving the way in which their values, preferences, and needs are upheld. Creating a positive culture around issue resolution is a first step in opening up opportunities for resolving problems by the Unit-Based Leadership Council. This helps improve relationships amongst unit staff, which can positively impact patient care. There's one UBLC in particular which uses the SBAR tool to evaluate an issue and submit it to the committee. Situation: what is the issue, problem, or idea? Background: what is the clinical context, hospital policy, or standard of practice surrounding that issue? Assessment: what do you think the problem is? What is really happening? Recommendation: what would you do to correct or improve this? How do you get a UBLC started? Create a shared governance mission statement for the organization. Write bylaws or ground rules detailing how the council will operate. Bylaws should include a standard for accepting volunteers for membership, a maximum number of members, the schedule and rhythm for meetings. And these meetings should be mandatory and the chairperson needs to facilitate them. Term limits for members and plans for member turnover needs to be established. Also, open communication and confidentiality should be the policy. And finally, establishing guidelines regarding issues brought to the council is the most critical part of creating council bylaws. These guidelines will need to be communicated to all staff to encourage nurses to bring issues forward for consideration. This will help them understand the process and timeline for resolutions. It should also be determined who will be responsible for implementing the changes and explaining the voting process. Creating a charter that includes short and long-term goals. Additionally, the council's overall structure should encompass how the unit selects its leadership group, how the manager mentors the council on its new authority, and how council members can skillfully discuss issues in a way that promotes resolution. Establish a method of communicating general information and outcomes to staff at all levels of the organization. Structural factors, including role identification, support processes, decision structure, scheduling, and education, are crucial to successfully communicate a vision by senior nurse leaders. Educate staff about the shared governance model and their role in it. When forming or restructuring a UBLC, leaders must create energy around the council's purpose and educate staff on the return on investment. They need to establish a clear purpose for the council from the beginning. Ask a staff or volunteer to hold an election. The more involved members are, the more optimally a UBLC can function. Staff can nominate themselves or their peers to represent them on the UBC. They may need to urge peers to apply for this role. Staff also need to feel confident that the UBLC members will act in the unit's best interest because the unit's work directly affects unit outcomes. So those nominated as council members should have a respected skill level and be perceived as capable leaders. You should also create tools to evaluate outcomes. Members are able to have a way to evaluate outcomes and adjust their structure to ensure shared governance and promoting high-quality patient outcomes.
So, who should be involved in a union-based leadership council? In order to have a wide range of perspectives, all members of a nursing unit should be involved in the UBLC. Nurse managers specifically should have the responsibility to equally recognize all members of the unit and encourage their involvement in the union-based leadership council. They can create and incorporate decision involvement surveys to help identify gaps in the team members' perceived idea of decision-making autonomy compared to their actual ability to independently make decisions. The floor nurses. The floor nursing staff have a responsibility to themselves and their patients to be actively involved with the decision-making process for policy implementation within their unit. So for nurses, policies directly affect the nursing process and how the nurses and staff are able to deliver patient care. And, importantly, involvement in policy formation can also offer nurses protection from legal and professional repercussions. For therapists, this can include respiratory therapy, physical therapy, occupational therapy, and more, depending on what the place of work has to offer within its facility. Therapists may have different roles in their own designated job descriptions, but all essentially follow and enforce policies to obtain consistency and safety for patient care. So regarding techs, certified nursing assistants, and other staff, having the perspective of not just the floor nurses, but everyone involved in the patient care team allows for interdisciplinary decision-making and identification of issues, which gives us various perspectives of how the Union-Based Leadership Council recommendations can be implemented and how those recommendations will affect all members of the patient care team. Ideally, as many stakeholders on the unit as possible should be involved. So staff responsibilities, we're going to assess, discuss / diagnose, plan, intervene, and evaluate. So for assessing, we would want to gather information about the subject to be changed or resolved. So whatever that may be, we want to assess the problem and just get an idea of it to begin with. To diagnose or to discuss, we want to discuss with all members involved in the subject and all those who it will affect. So like we talked about, getting various perspectives from people and hearing what they have to say is very important in trying to make up a plan for to create a solution. So P, the plan, we want to create goals or a desired outcome and identify nursing actions to be implemented and changed. So it's also important when creating a plan to take into consideration all the people who work together in the work environment, because one way or another, the plan will be affecting everybody. And I, to intervene, we want to implement and enforce the new plan by educating all staff on the new policy and ensuring they all receive accurate information. So we'll be talking about marketing and deliverables and how those can really help with keeping people educated. So that could be one way, by doing a staff meeting, something of the sort, to make sure everybody is on the same page with up-to-date information. Oh, no! And lastly, E, to evaluate. We want to evaluate to determine if our goals and expected outcomes have been achieved, and this can be done by reassessing the subject with all members and encouraging their input to see how it's all been working out. So staff buy-in. So encouraging volunteers, we can use platforms such as social media. Mandatory staff meetings, emails, and visuals are a great way to encourage others to participate. We can hold elections for council positions. This can help all members feel they have a voice or a say regarding the Union-Based Leadership Council. We can encourage nurses to bring issues forward. If they don't bring it to the attention, then who will, right? So it's important to encourage them to bring the issues forward and make them known to other people because they might be seeing the same thing. Belief in a cultural open to change. So all members should have a positive attitude towards change and incorporation of new policies. Collaboration. All members of the healthcare team should be involved in policy changes that affect the care they will give within their scope of practice. Support nurses' transition into decision-making roles. That one's pretty straightforward. Nurse empowerment, we want to remind nurses that they can have the autonomy to take control of their own workplace and create solutions by speaking up and taking part in the union-based leadership council. Autonomous practice. Each patient's individual satisfaction varies from situation to situation, so encouragement of nurse and patient autonomy is key to optimal patient care. And shared decision making. Nurses should take responsibility for improving patient outcomes by respectfully working together to brainstorm ideas, share observations, and present evidence that may help resolve an issue. And marketing for a union-based leadership council. So we could do brochures, emails, social media, break room advertisements, or flyers. Brochures offer an attractive display of council highlights, and the details allow its recipient to take it with them and review it wherever. These can be helpful as they allow people to take home critical information that can be easily accessed at any time, and these physical copies should be kept up to date with current information and brought to attention, if not, to ensure that all parties are receiving relevant information. Emails. Emails are a great way to reach out to all members of the staff to participate in the union-based leadership council because it serves a purpose of convenience for everybody, especially those on night shift and per diems who you may not see very often in person. So this ultimately leads to effective communication between individuals of diverse levels of workplace activity. It is important to remember to keep emails compact and to the point, as workers can become kind of overwhelmed with the full work inbox that still needs to be reviewed. Social media. So social media advertising through social media encourages a more comfortable environment and allows potential members to observe communication and encourage all members to take part. Receiving cues such as a group invite through social media can promote participation due to its casual formality and open access to updates, previous posts, and fellow colleagues' comments. This can also be a great way to answer questions for everyone to see, which can save everyone from privately emailing the same questions to a higher up. And break room advertisements and flyers, using physical copies and visuals such as a break room advertisement and flyers will draw attention while in the workplace, which could potentially give employees a reason to act or respond. And finally, our deliverable. So before I show our deliverable, I just wanted to talk about how our group has created a brochure regarding the shared leadership leadership council using attention drawing tools such as color contrast, pictures, bolded lettering for key information, headlines, clear and concise formatting, but overall highlighting who we are calling to attention, whose interest is at stake, why should they desire to take part, and what actions should be done to support the topic. We have also ensured that our brochure includes all aspects of the group, such as its mission, member roles, responsibilities, structure by the way of meetings, past accomplishments, and of course, the contact information. We believe that a brochure was ideal for this topic because it can be easily shared amongst all staff and distributed in the work environment, such as placing a brochure in everyone's locker or their designated cabinet, break rooms, nurses' stations, and even staff restrooms. This way, all the employees can have access to the information from all areas, allowing more time to create considerations to present to the Union-Based Leadership Council. So as you can see, here is our deliverable brochure for the Shared Leadership Council. So up here we just have the hospital that it pertains to, Port Angeles Memorial Hospital. We have a bolded headline here, basically just straightforward telling you what it's going to be about. Bolded date and some pictures to draw attention. We have our contact right here. And here it's saying what we want to do, basically what the mission is for this brochure or this event. And just some questions to get people reading into it and connect a little bit more with it. Basically right here, we just have it explaining why it's important for the staff and the management and the decision-making process to involve workplace practices and patient care, saying that we recognize the importance of clinical staff, knowing who your deliverable or your brochure is speaking out to, and down here explaining how it's important. Participants will have protected time for meetings and related work. This won't be extra work. The council will have decision-making authority. Responsibilities and allocation of duties will be clear. The council will be accountable to other staff and management and bringing your ideas to the information meeting on June 18th. You can help improve our work environment, staff safety, patient care, and organization policies. So being straightforward and encouraging people with positive words is very important, especially when you're speaking to people in healthcare. And that wraps up our presentation on the Union-Based Leadership Council, and here are our references.